Nexus is an advanced technology solutions provider to our customers. We provide solutions to our clients around those technologies that they need to drive and grow their business. So that's everything from unified communications, which is the phone on the desktop, to video communication.
We really don't focus on the product, we focus on our people. It's our people's experience, expertise, and our ability to execute that sets us apart.
Nexus is extremely committed to healthcare. Nexus connected healthcare and the investments that we've made in that healthcare space have allowed us to grow the healthcare segment of business, which we really define as that payer-provider space, to roughly a third of our overall revenues.
Nexus Connected Healthcare delivers really a portfolio of services around technologies that really help people, process, and technology, and really improving patient care. We start with core foundation services. Core foundation services is really about delivering the resiliency, the reliability, the availability, and the compliance that are necessary in a clinical environment so that you can ensure that clinical payload is delivered when it's needed, since life and death are really in the balance in patient care. The second one is really focused on distance care services. Distance care services allows a physician to engage with a patient, reducing the miles between them, whether they happen to be locally in that facility or in an outlying area, through the use of telemedicine, telepsychology, web collaboration, physician collaboration, really looking at all the information that it takes to determine outcomes and improve the direction of that patient's health. Thirdly, point-of-care workflow services. Point-of-care workflow services is really focused on taking that information that's in a plethora of systems within the environment, and via web services and HL7, collect important and relevant content and deliver it where it's needed the most. Looking at devices such as handhelds, the droids, the iPhones, being able to make them part of the patient care experience, getting information such as lab alerts or even messaging, and then take that content, act on it, and return it back to the medical record so you ensure your compliancy and reduce some of the effects of all the documentation challenges in the future. Lastly, patient hospitality services. This is really how do you engage with the patient. So whether it's a call center, so that you're getting the right information to that call center attendant to be able to engage with the patient quickly, efficiently, and in a documented, compliant fashion. Being able to secure the work areas around it through physical security. Being able to share messaging around things like smoking cessation, disease management, right? Overall, well and care about yourself as a patient.
Molina Healthcare, a Fortune 500 company, has grown into being a leader in providing quality healthcare services for the financially vulnerable individuals and families. Molina Healthcare, currently what they do is they provide and arrange delivery of healthcare services to over 4.3 million people that rely on programs such as Medicaid and Medicare and other government programs.
Molina Healthcare specifically, we enjoy a tremendous relationship. It is one as really truly that trusted advisor, right, where we participate with the Molina team in advanced planning, right? What's coming for Molina down the road in the next year to 5 years.
The relationship with Nexus is beyond just partnership. Actually, they're part of our team. We've had a lot of major projects and also some, challenges with some of the new technology that we're implementing. And Nexus is always there with us. Some of their engineers even traveled with us to our other remote offices to help us support the migration for the new projects. And when we run into really a complex problem, with the configurations and even, the engineering and design, there are Nexus engineers that actually work hand in hand with our network team. Technology in IT is very critical. It's an enabler. Besides we provide Medicaid, Medicare solution, we also have 20 plus clinics, 27 clinics. And we have electronic medical records that we've already deployed in those clinics. The patient relies on their prescription, their medication, their doctor's appointment, and that's only one of the system. The other one is for claims processing. If we have an insurance claims, if the system in IT is down, then we're not able to process those claims. In the IT healthcare industry is very important collaboration. You need to really, because we're in working nationwide, and we're in different, remote offices. So really the collaboration is very important for us because we save, some travel budget. We also communicate well by having both voice and video conferencing, and all the WebEx Connect and all the Cisco collaboration tool is very important by just open communication and just, communicating all the time because we're getting bigger.
Molina is an organization that is growing, so not only are they growing in the voice and the contact center space, they're growing in the data center space, they're growing in storage and virtualization. Nexus has the ability to bring expertise in each of those fields to Molina, and we can go and prove to them what we've been able to do in other areas of the market.
For Molina, technology absolutely helped them increase efficiency in a lot of different areas. In their contact center, it allowed them to communicate with their customers more quickly, more efficiently with less people, and improve that customer satisfaction rating for their customers.
We're looking into hopefully doubling the membership growth of Molina, together with the partnership and also working relationship with Nexus and all the engineering team that's here. I'm confident that if we have issues, I know it will be resolved.
One of the biggest challenges in healthcare is engaging with the patient, not engaging with the systems. Things that we can do to help streamline, make it more efficient, reduce the miles that a nurse walks on a daily basis that allows them to be with the patient, taking care of the patient, and engage with the patient. That's why they're in this business. That's why we're in this business.